Democratic leaders in the House and Senate hope to pass health care reform next week by means of a parliamentary procedure known as reconciliation. Here with a look at how that works and what its prospects may be is CBS News political analyst John Dickerson, who joins us from Washington tonight. John, good evening to you.
Good evening, Jeff. House Speaker Nancy Pelosi has pledged to pass a health care bill in 10 days. With Republicans unified against her, that means a scramble to find a majority of Democratic votes. And in keeping with a legislative process where nothing has been straightforward, the last stage will be just as complicated. To enact health care reform, Democrats in the House must pass two bills: the 2,000-page health care bill the Senate passed last December, and a second House bill of about 100 pages that modifies the Senate version. Without those changes in the second bill, Pelosi could not get a majority of Democrats on board. If she can find the votes, the president will then sign into law the larger health care bill, which will have at that point passed both houses. Only then can the Senate start work on the House's smaller bill of changes, using a procedure known as reconciliation, which requires a simple majority, 50 votes. Intended to avoid a Republican filibuster, reconciliation cannot stop Republicans from offering amendments and trying other methods to derail the process.
We have to do something else that's tough for we House members, and that is to trust the Senate to do what they say they're going to do,
If Senate Democrats prevail and pass the second House bill, then the president would sign it, ending the process. President Obama actually delayed his trip to the Far East by 3 days to next Sunday, when the House is expected to complete its work. But for the past year, health care deadlines have come and gone. So if the president must wait for the House before leaving town, he may not be going at all. Jeff?
Okay, so John, as they try to do this, what are the main sticking points?
Well, the main sticking points are there are a number of issues like abortion, immigration, and the big one, though, is the one Congressman Anthony Weiner talked about, which is that the House has to trust their Senate Democratic colleagues. If the Senate cannot pass that second bill, all Democratic members of Congress will be stuck with the Senate bill with its unpopular provisions like the special backroom deals for Nebraska and Florida, and that'll be very tough to defend in a year when Republicans say they want to make health care the central issue of this year's election.
Should be an interesting week, to say the least. John Dickerson in Washington. John, thank you.